Afternoon, everyone. Bevis Phiri is my name, from Zambia. I'm a researcher from Clinton Health Access Initiative, and I'll be presenting the AMBIT project, presenting on the abstract titled, Does Differentiated Service Delivery for HIV Treatment Change Healthcare Providers' Workload? Views from Malawi, South Africa, and Zambia. Okay, so as we all know, there's been a rapid scale-up of DSD models across Southern Africa, and these aim to reduce kind of the workload in the facilities, as well as improve quality of care. However, there's been limited evidence on the effect of providers' workload, and therefore we aimed to explore providers' perspective on the effect of DSD models across 3 countries, which is Malawi, South Africa, and Zambia. Okay. All right, so we surveyed about 43 health facilities with a convenience sample of up to 10 providers, which included clinical and non-clinical healthcare workers, and these were either directly involved or indirectly involved in the implementation of DSD models at each facility. And a total of 444 providers were enrolled between a time period of April and November 2021. And quantitative and qualitative questions were used during this survey. Okay. Sorry. All right, so in terms of the results, we find that overwhelming providers reported that DSD models implemented affected and led to changes in their jobs, and with over half of them acknowledging that it freed up time, made job easier, and changed how clinics are managed across all the 3 countries. However, we see a stronger response from Zambia with over 90% of the responses being very strong, followed by Malawi and then South Africa. Okay, so the freed up time that we just saw on the previous slide can be attributed to the fewer patients that were being seen according to responses from the providers. We also see that this also might have led to providers spending more time with individual patients, and we also see that queues became shorter during this time around. And qualitatively, we see that the responses were similar, and providers citing that they actually had low stress levels overall due to the DSD implementation in Zambia and across the other 2 countries. And in conclusion, we can say that all the countries did agree that DSD models led to a change in terms of freed up time, workload, as well as other aspects of decongesting the clinic. And acknowledgement goes to all our supporting partners that you see, and our poster is on stand 19, and you can come through for more details since we had limited time. Thank you very much.
Thank you. This study, this research was done to actually figure out, because Rwanda started this MMD implementation during 2016, after the WHO guidelines recommended MMP to be able to continuously help facilities to encounter the overwhelmed and compromising service delivery and client certification. So the eligibility criteria to move patients to MMD was started in 2017 in Rwanda, and it was based on adults that were established on treatment. That's a 1 year on ART, and having a 2 consecutive viral load suppression of less than 200 copies. So later on, we shifted to 6 MMD in the next year, and in 2020. So The rationale behind was that we didn't know that how are clients doing, because we only see them after 6-month period. So we wanted to compare patients that were, clients that were already on 6-MMD, 3-MMD, and to compare them to those that, when they shifted on 6-MMD. So this was, there were two things that we were looking at. We're looking at viral load suppression and the retention rate. So as you can see, this is the cumulative growth of patients that are going on ART in Rwanda. And this is the trend in which people are shifting from 3-MMP to 6-MMP. So you see that the curve is rising for those that are on 6-MMP, which shows also that more of our clients are actually stable, and we have over 75% of the clients being stable. That means they are categorized in 3-MMP and 6-MMP. So when we reviewed charts in 22 health facilities, we actually looked at these two indicators, as I told you, the viral load suppression and the retention rate. So this was the client population that we had, that we reviewed, and there was actually no significant difference in the mean log values for both 3-MMP and 6-MMP. And we saw that 28.7% of people had a viral load target not detected. That means it was 0 on 6-MMP, with a good significance compared to those in 3-MMP, which also had around 22.7. So the proportion of people living HIV with viral suppression during 6-MMP period was very high, which was 99.4, but slightly lower with that in 3-MMP, which was 99.8. So the retention improved with exposure time from 67% to 74% after 12 months. So satisfaction showed no significant difference in age and sex, age groups. So as a conclusion, we recommend that actually there should be transitioning of people living with HIV established on ART from 3-MMP to 6-MMP because there was no major effect on viral load outcomes. And the retention improved with establishment on ART, so we recommend that clients that are established on ART for a year could actually go for 6-MMD and help decrease the overwhelming health facility work. Thank you, and I give attributes to RBC, which is the implementing body of MOH, and ICAP, which supports us through Sequin network to do DSD work. Thank you so much.
Good afternoon, everyone. I'm Phoebe Mbabazi from the IDI. The topic of my presentation is risk factors for frailty in a geriatric cohort on long-term ART in Uganda. So frailty is an age-related syndrome. It is marked by diminished physiological reserve and vulnerability to stressors. And because of that, it's predictive of adverse outcomes like hospitalizations. And it is more common and occurs earlier in persons with HIV. So we determined the prevalence and risk factors for frailty in our cohort. Frailty was defined by criteria proposed by Phiri and colleagues, which has 5 parameters: unintentional weight loss, exhaustion, weakness, slow walking, and low physical activity. So presence of 3 or more parameters is considered frail. 1 to 2 is pre-frail, and if you have none of them, then you're non-frail. We performed logistic regression, controlling for factors like gender, age, CD4 count, comorbidities. A snapshot of our cohort. So we enrolled 500 participants. Our median age was 64 years, 48.8% are females. The median CD4 count, the baseline is 159, and the current CD4 median is 645. Our median time on ART is 15 years. Patients had very good viral suppression, 99.6 are suppressed, 5.6% are underweight, while 43.5% had a BMI more than 25. 31.2% had a household income less than $1 a day. At multivariate analysis, being male and having normal BMI or high BMI was associated with a lower likelihood of being frail, whereas having an income of less than $1 a day, having cognitive impairment and presence of depression were associated with a higher likelihood of being frail. So basically the frail people were more likely to be female, underweight, cognitive impairment, depression. In conclusion, despite the exceptional rates of viral suppression and robust CD4 recovery, more than half of the patients were frail or pre-frail in our cohort, highlighting the clinical relevance of this condition. Frailty assessment may pave the way for preventive or multidisciplinary actions in mental health and nutrition. Thank you so much.
Okay, thank you very much. Just a correction, I'm not Zambian, I'm Cameroonian. It is a mistake. I'm Cameroonian, I'm not. Yes. Okay, thank you very much. So, the theme of my presentation is Community Antiretroviral Therapy Dispensation in Cameroon associated with superior client outcomes, a national evaluation. Slide. Okay, in Cameroon, HIV is still a public health problem. Among 496,506 people living with HIV, 84.6% knew their status. 90.6% who knew their status are on ART. But this is good progress in the response, but retention and viral load coverage and suppression remain challenges. Community-based organization distribution of ART dispensation was introduced in 2016. PEPFAR USID via FHI 360 EPIC support MOH to evaluate the model. So evaluation design examine two cohorts of clients for retention and viral suppression. The objective was to assess the impact of CBCO dispensation of ARV on treatment continuity and viral suppression at the health facility. The data on retention and viral suppression was abstract from LRT register and DAMA for the period of August 2014 and October 2020. For treatment continue, we have two comparisons, but on 3 months, 3, 6, 12, and 24 times since enrollment. First comparison, cross-sectional. Treatment continuity at 50 CBCOs versus treatment continuity at 22 health facilities that enrolled trial on the CBCO model. Second comparison, cross-sectional. Treatment continuity at 3 health facilities that enroll clients on the CBCO's model versus 3 health facilities that do not enroll clients on the CBC model. For viral suppression, we have cross-sectional. Treatment continuity at 50 CBCOs versus treatment continuity at 32 health facilities that enroll clients on the CBCO model. So for the result, according to the data, we have in retention rates. CBCO clients had higher retention than those receiving refills at health facility. Health facility offering the model that higher treatment continuity than at health facility that did not offer the CBCO model, not significantly at 3 months and 24 months. For viral load suppression rate, according to the data, viral load suppression load was higher at CBCO than at health facility offering the model each year, but significantly only in 2018 and 2020. So in conclusion, we have CBCO dispensation was associated with higher treatment continuity and viral load suppression. Secondly, the model has the potential to improve clinical outcome for clients who are enrolled and those who would continue receiving care at health facility that offer the model. So community can do better, give them confidence, train them, and give them means to act. So thanks goes to USAID PEPFAR, FHD 360, Right Care, Palladium, PSI, and GOBIS. Thank you for your attention. I'm there to give you more detail near my poster. Thanks.